An acute myocardial infarction or heart attack is a disease that can suddenly affect the heart. It occurs when a coronary artery is obstructed due to a blood clot. It is sudden chest pain, usually in the center of the chest, but at times it may appear in the shoulder or left arm, in the neck, back, or abdomen. It is associated with heavy sweating. In some cases, there may be lack of breath, vomiting, palpitations, and loss of consciousness. Sometimes, however, the heart attack comes with symptoms that are not as violent, more bearable and intermittent, which can be misleading. The chances of recovery depend to a great extent on how quickly the emergency services arrive and treatment is given. Do not waste time. You must call 118 or 112 were activated immediately. On the telephone, the operator will ask some questions about the symptoms, the type of pain, its intensity, associated symptoms, history of heart disease, and, in the meantime, will send an ambulance immediately. It is important not to drive or to be taken to hospital. You must always call the emergency services because some serious complications, such as malignant arrhythmias, can be treated promptly only by medical or paramedical personnel with the correct equipment. While waiting for the emergency services to arrive, collect the medical documentation, the health card, and any medicine that the person is using. When you hear the sirens, make your position clearly visible. As soon as they arrive, the emergency crew take the vital parameters and do an ECG. If this confirms the diagnosis of a heart attack, in hospital the patient will undergo an attempt to open up the coronary artery. Even though the ECG does not show signs of a heart attack, it may at times nevertheless be advisable to take the patient to A&E for the necessary tests and care. The ambulance goes to the hospital indicated by 118, which is not necessarily the nearest one. The siren may not be on. As soon as the patient arrives at the hospital, the triage nurse assesses the case, followed by the doctor depending on the level of urgency. In the meantime, the relatives or accompagners can wait in the waiting room. In some cases, an accompanier must be authorized to stay with the patient during the examination. After an initial assessment, the doctor may give information to the relatives if the person wishes. In the case of an acute heart attack, the earlier the obstructed coronary artery can be reopened, the quicker and more complete recovery is. The coronary artery can be reopened by drugs capable of dissolving the clot that obstructed the artery, thrombolysis, or with a balloon catheter, angioplasty. If the attempt to reopen the vessel is successful, as in the majority of cases, usually only a hospital stay of a few days is sufficient to keep the situation under control, start the treatment to reduce the modest consequences, and limit the risk of new attacks. In some cases, however, the heart attack can cause substantial damage to the heart muscle and require more complex and prolonged treatment, also followed by a period of rehabilitation and functional recovery. Afterwards, to keep the heart healthy and avoid relapses, it is important to associate a healthy lifestyle, listening to the advice of the healthcare personnel with the medical treatment. In all cases, calling the emergency services promptly and knowing how to behave allows faster help and better care. Call the emergency services. Save a life.